It's a terrific system, and in my patients it's working extremely well. So we want to interfere with that, and when we do the bypass, we interfere with the digestion and absorption of fat. When we interfere with that, what happens is the fat then gets down into the intestine undigested and can cause a lot of gas. So post-operatively, if you want to have a big fatty encrusted steak, you may. If you want to have a big spoonful or a cup of ice cream, you may. If you want to have cheesecake and fried chicken, you may. But remember, that fat is not going on your hips. That's our bargain. That's the power of my therapy. That fat is not going on your hips. You told me you want that, I'm going to do that. So if you eat a greasy meal, it's not going on your hips, it won't be digested well, it will end up in the colon and it will cause a lot of gas. Okay, so to avoid that, not such a greasy meal. Okay, you have to say, boy, I'm feeling, I've had some bloating, some gas and things like that. I'm going to decide to have a light salad tonight. Because the salad, easy to digest as long as you don't pour on a big blob of blue cheese dressing. Now there's some other tricky foods you might not think of that aren't so greasy but can also cause tremendous amount of gas, and that's because of a funny little sugar called lactose. Dairy products have a very important sugar that's critical for us as children and babies as we grow up, and that sugar, lactose, is undigestible by us as human beings unless we have a specialized enzyme called lactase. The lactase enzyme breaks the sugar into two pieces and then we can absorb it. But if you don't have that enzyme, then you eat dairy products with lactose in it, that lactose sugar, just like the fat we just talked about, is not digested properly. So then the sugar goes down, and the same thing, big kinds of development of gas, almost like an explosion. So you can have people who are lactose intolerant, their stomach bloats up, crampy pains as the body tries to move that gas through, and you can have foul-smelling gas from that as well. So again, there's a simple solution for our patients post-op, and that is to be careful about dairy products. As you may notice in the grocery store now, because a lot of people who don't have the mini-gastric bypass are also lactose intolerant, you can probably find in your grocery store milk, for example, that has no lactose, lactose-free milk. That's going to go down better if you're having trouble with gas and dairy products. Similarly, it may be hard to find lactose-free ice cream or lactose-free cheese, but you may have a taste. You say, boy, I'd love an ice cream cone. Not as a foundation of your diet, but I would like to go out and have an ice cream cone if I feel like it. Well, how can we solve that problem given the bypass that we've done? Well, again, in the grocery store, you can go and down the aisle, you can probably find some lactose enzyme, some lactase in a pill. And in the United States, it's called Lactaid. So if you decide you want an ice cream, you can keep in your purse a little Ziploc baggie of some Lactaid tablets and take that and help protect yourself from a lot of the gas problems and things like that. Also beware that it's very surprising just how many foods actually have lactose in them. And the reason is if you're a manufacturer and you want to create a food, you can really help it by throwing in some milk protein, because it's non-fat and it bumps up the protein and doesn't affect fat. So that combination, you'll find it in lots of cookies and this and that where they've thrown in milk protein, and the side effect for you, if you don't realize it, is it may commonly contain some contaminant of lactose. Not that they want it, but just hard to get it out of milk. So if you dry milk, you get a lot of lactose. And then if you add it to cakes and cookies and pies or protein drinks and things like that, and then you as an MGB patient drink it, again, you may suffer from cramps and nausea and gas. So think again about what your question was. Can you get gas from the surgery? Absolutely, because I'm going to intentionally interfere with the digestion and absorption of certain kind of foods, especially fat, unintentionally because of lactase enzyme being the upper gut. We bypass that. Lactose is a problem. And then of course you know that there's some foods that are well known even in people without an MGB of having difficulty with digestion. And there are things like beans and cabbages and stuff like that where they have these carbohydrates that can be difficult to digest, and with our bypass they can cause problems. So Post-operatively, most of our MGB patients can manage things, but again, beware. There is a possibility that if you're just eating without thinking, a hot dog, a pizza, a fried chicken, ice cream, these are high-fat or lactose-containing foods, or my favorite is an example, the cheesy bean burrito. That's one that's likely to get in trouble. Oh, that's a good question. I get an error message. Oh, the battery. Huh?